Hi everyone, this is my week 15 video. I just can't get over the fact how quickly time has gone and that next week is our last week in the program and at our field placements. It's definitely bittersweet. I'm so excited to be, finishing this chapter and this experience and completing this program and moving forward with my career. The last 3.5 years have just gone by so quickly and I'm thrilled, but it's also a little bit sad. It's like the end of an era, no more homework, no more class, no more field placement. So it's going to be a big adjustment, but I'm really happy and really excited. I'm definitely going to miss my placement. I feel like I've really learned a lot there. It's really different at the school than what I'm used to. My experience has all been in an outpatient program at a hospital, and then on the inpatient unit, of course, and then in the emergency room. So the school is really just a totally different environment and has just been a really different experience for me. I think going into this experience, I always thought I wanted to work in a school. Obviously the hours are really great and, I definitely know I want to work with kids and adolescents. So I always thought it would be the perfect job for me. Over the last, 7 months or so, I've gone up and down and changed my mind a little bit about what I wanted to do. I'm fortunate in having a couple opportunities presented to me. Obviously, the job that I'm at now is actually a master's level job on the inpatient unit because I do have my master's in psychology. So I get paid really well there. It's a primary therapist position. So getting the MSW is more just to get licensed and, kind of just the direction I wanted to take with my career. So I do have the option to stay in the position that I'm in, which is a great job and I love. My job also, they're talking about adding another clinician. So right now I just run groups, but then I would be like more of a case manager, social worker on the inpatient unit. So my boss has said if this position is created that she'd like to have me apply for that. So that's another great option. I don't know financially, I don't think it's much more, of a raise or anything, but it would be a really great experience for me moving forward in my career. The emergency room where I did my first field placement has per diem positions available and my, supervisor there has always, which is also affiliated, is the emergency room of the hospital that I work for. She would like me to kind of go there as well, either per diem or hopefully if there was an opening, I could be, a crisis worker there, which is really exciting, really interesting. The only thing about that is that it's not really, you just see the patients in crisis and you don't really get to follow caseload. And I really like that, working and doing therapy with patients, or clients. So, I don't know about that, but per diem, that would be pretty cool. And then of course the school. The problem with the school is that in 2014, of course, in Connecticut, now you need to take a graduate level course, school social work course, which University of New England doesn't offer. When I was applying for schools, this wasn't an issue. But now in order to be a school social worker in Connecticut, you have to take a graduate level school social work class. So, I think I emailed the Connecticut Association of School Social Workers, and she said she thinks one of the lady I spoke with believes there's a grace period because obviously I was already in the program before this standard was created. Or I could always just take one more course after, I complete the program if I really wanted to work in a school. But I know it's a really high demand to be a school social worker. I love the school. I've really learned a lot there, and it's really like a whole different world of social work, I feel like, being in the school. The one thing that I don't really like about the school is I feel like you're kind of on your own and it's difficult because everybody has their own agenda, which I know is true at every job, but the teachers, have one set of standards of what they want, and it's kind of hard to get everybody on board, I think, with like a treatment plan for a specific kid. But that could also just be the school that I'm at. And also, to be honest, some of the kids, I guess I'm more used to higher acuity and like crisis management and things, and as I've expressed in previous videos, frustrations with, just the kids that don't have motivation to do their homework and that, don't pay attention in class and things like that. And it's just kind of, working with them week after week after week and not seeing improvement has been like a little bit frustrating for me. But I was thinking maybe something like in a therapeutic school or a clinical school would be a really great job for me. So at this point, they're talking actually about adding another social worker position in the school where I'm doing my field placement, which is just amazing that these opportunities are coming up. And my supervisor has really, been vouching for me and encouraging me to go for that, and in the hopes that I wouldn't need that extra class. So, I mean, I feel really fortunate, obviously, and I hear so many people in the last week were talking about all the opportunities that they've had to stay on at their field placements, and I just think we're all really lucky and blessed to have these opportunities, because I know it's a really demanding field and a really hard field to get jobs in. So I'm just kind of weighing my options right now, but I was just kind of wondering if this experience has kind of caused anybody to change their area and what they wanted to do with their practice in the future. I know I always wanted to work in a school. Now I'm kind of leaning towards more of like a clinical school, or maybe staying in the hospital setting. And, I love the school, but I'm just weighing my options at this point. So I'm just wondering, I know I still want to work with adolescents, but does anybody, change their mind about what course they wanted to take in their career path following this experience? I hope everyone has a great week, and see you next week.